Dr. Epstein here to talk about achieving natural results in beard transplants. Well, what do we not want when we do beard transplants? Well, this is an example. See how the hairs are sticking out? There's 3, sometimes even 4 hairs into each recipient site. This was done elsewhere. And this gentleman came to me for a repair where he removed hundreds of these prior placed grafts. And you can see the after. I was able to basically remove these grafts doing an FUE removal process. So what do we want a beard transplant to look like? Well, here's a couple of before and afters. We can see one patient here, another patient, and a third patient. All ethnicities, all different kinds of hair colors, texture, curl, as well as the goals of the patient. And in order to achieve natural results, there's 4 or 5 things I really want to do. The first is I want to use very small recipient sites using a 0.5 millimeter recipient site. That way you minimize the movement of the grafts. Using a 0.5 millimeter recipient site as I do with eyebrows or as I do with hairlines is what achieves or allows me to control the direction of growth that the hairs eventually will take. Secondly, the grafts are properly handled. The excess skin is trimmed away so we don't get those little bumps. Thirdly, the grafts are placed at just the right direction. Fourthly, I'm packing in the grafts and having them grow with the desired concentration as well as direction. And then finally, the design of the beards. Having done well over 800 beard transplants, I'm quite facile in achieving natural looks and, of course, being prepared to use as many beard grafts as we need to. The only thing patients need to realize if they're rather young and they're at risk for future male pattern hair loss, whatever hairs are transplanted into the beard, on an average 2,000 to 2,500, those will be some grafts that won't be available if desired in the future. A hair transplant to the scalp is desired. But all ethnic groups are candidates when done properly. Here's another example on a black patient. And having done beard transplants for probably 15 years, I think I can assure my patients of achieving natural results. This is Dr. Epstein. Thank you.